Good news about the pandemic. Yes, we all need it. Researchers say the first COVID-19 vaccine tested in the U.S. improved patients' immune systems just like that they hoped it would do. Now, the trial run began with 45 people in March. Now it moves on to mass testing. So as always, we have our medical expert, Dr. Kohli, to help us better understand what's happening. So Dr. Kohli, how optimistic are you feeling about this vaccine? When could we see it in pharmacies? When could people start taking it?
You know, Sam, I'm feeling pretty good and pretty optimistic about this, but I'm not quite ready to break out my champagne yet. So I would say on a scale of 1 to 10, I'm probably at a 6 or a 7. So they took years and years of what normally would take years of research and shrunk it down into a few months and showed that in these 45 people, not only are they all mounting an antibody response, they're getting the right type of antibodies, and they're having very few side effects. But if you look at the flip side of it, it's only 45 people. So it may take a bigger number for us to really start to see those safety signals. We also don't know how long those antibodies are going to last, which is an important question when it comes to immunity. And if you look at the breakdown of the trial, the majority of patients were actually white. So they only had 1 Asian patient, 2 Black patients, and 6 Hispanic patients. So we don't know if these results can necessarily be extrapolated to minority populations. So I'm excited about the results, but I'm waiting to see what the bigger trial shows before I really open up that champagne.
Hey, a 6 or 7 excitement scale? I'll take it at this point. Can you explain how the vaccine works, doctor? Is it only for people who catch the virus, or can people take it to prevent catching COVID-19 as well?
No, in fact, the main purpose of the vaccine is to really prevent you from catching COVID-19. So the way this vaccine works, it's called a messenger RNA vaccine. And that's a fancy way of saying that they take a piece of the genetic code of the virus and inject it into you. So you can't actually catch the virus from the vaccine, which is really great because it's only a fragment of the genetic code of the spike protein that the virus uses to enter cells. And then your body actually makes that spike protein in response to that genetic code and trains your immune system as to how to fight the virus if you were to get exposed to it. So I like to think about it as a football analogy. I know Sam loves my analogies, but it's basically like having the playbook for the other team's plays before the game so that your immune system knows exactly how the virus enters your cells and it can have the playbook to learn how to fight that.
Good analogy. Okay, so we're running out of time, so quickly, because I know everybody wants to hear this. What do you want to say to people who are skeptical about receiving a vaccine?
I would say that this is the only way we're going to get our lives back to normal, you guys. So we have to take that vaccine. Vaccines have been shown to eradicate diseases like smallpox, tetanus, and polio. So we have to get all hands on deck for this. And the point of the clinical trial is to prove that it's safe. So trust the science that it's not going to release it to the community until it is shown to be safe.
Wow. I hope sooner than later, personally. I really do.
I think everyone does.
Well, no, some people are...
Oh, you mean the vaccine? I got you. I'm going to stick with the positive on this one.
Okay.
We're at 6 or 7.
6 or 7.
Let's keep it half full.
Yep. Thank you, doctor. You will be back tomorrow. And again, everybody, no panic. Just prevention and precautions.